Hello, my name is Jason Chesney. I'm the director of the UofL Health Brown Cancer Center. So when I was at the University of Minnesota in college, I took a job as a nurse's aide on an allogeneic bone marrow transplant for kids. So it was little children, 2 years old, 3 years old, 5 years old. And I watched them hooked up to IV pumps and all the tubing I was 18 years old at the time, and realized that a lot of these kids weren't going to be leaving the floor alive, and that it was criminal that our society hadn't figured out how to solve this problem. And so early on, I decided that it was the right thing for me to do. I had a strong sense of what value could I bring to our community, to our society. At the time, I thought that focusing on a career in medicine and research would be the greatest value that I could do. Today, like then, cancer is one of the greatest challenges to Western medicine. It is still unsolved, but fortunately we're close. I specialize in melanoma and lung cancer. The reason that that's an unusual combination to some, I suppose, but the reason that I specialize in those two areas is that those two types of cancer have the highest rates of mutations. And those mutations are what lead the immune system to see the cancer cells. And so I do very aggressive immunotherapies to take a patient who has been told to go home and die and allow them to live a long life. When a new patient comes to see me, they come to see me because they have a tumor that they are unaware of. They don't have any symptoms associated with it, but they've been told this. And so they're looking down their future as if it were the barrel of a shotgun, or they're symptomatic. They actually are experiencing symptoms from their cancer. When they walk in the door, those are the two problems that I have to solve for them. And the first thing I do when I think about how to solve those problems is I think about them as if they were my wife or my father or one of my children. And I put everything I can into making sure that the individual I'm staring at in the room is going to live a long, happy life. UofL Health Brown Cancer Center is one of the few centers in the country, actually in the world, that offers a program called Tumor Infiltrating Lymphocytes, or TILs for short. And this is a cell-based therapy that's being used to treat patients with multiple types of cancer, mostly solid tumor types, including lung, melanoma, head and neck, and cervical cancer. In the United States today, there are no other centers that are offering all those TIL programs for those solid tumor types that are in the center part of the United States. We have patients coming from Colorado, Minnesota, Florida, Tennessee, Alabama, Ohio, to come to the Brown Cancer Center to get treated. And it's because we offer this very unique, very effective cell-based therapy called TILs. My goal in life is to cure cancer. And the way that I'm going about that is to try to develop new drugs that get FDA approved so that thousands and tens of thousands of people will be treated with those drugs. And so my goal in life is to have a tombstone that says, "Here lies Dr. Jason Chesney, who was instrumental in the development of the following 10 drugs that got FDA approved to treat cancer." I'm at 5 right now. My goal is to get it to 10. I'm happily married to a beautiful woman named Alden Clare, who's a radiation oncologist, and we have 4 children with a rather unique age range going from 4 all the way up to 25.